Na, game. Hi, I'm Maricon Suñas, a student nurse from Camarines Polytechnic College, BSN 2D, Group 3. So today I will be performing 4 procedures: NGT insertion, GAVAGE, LAVAGE, and NGT removal. So the first thing to do is confirm the physician's order, verify the client's identity, introduce ourselves, and then explain the procedure, perform hand hygiene, and then wear our gloves. So, hi ma'am. I'm Maricon Suñas, ang inyong student nurse today. So, bago po ako mag-explain sa inyo ng procedure, maaari ko po bang tanungin kung ano po ang inyong pangalan and then kung kailan po kayo pinanganak?
Ako po si Colin De Vera. Pinanganak po ako noong August 14, 2002.
So, according to the patient's chart, the informations that she provided was right. So, I will proceed to explaining the procedure. So, ngayon po ma'am, magpo-perform po ako ng unang dalawang procedures. Ang una po ay insertion. So, ano nga ba ang insertion? Yung insertion po ng NGT involves, meron po akong tubing na ipapakita sa inyo mamaya. And then yung tubing na po, yun ay papasok sa inyong nostril, dito po sa inyong ilong, and then patungo po iyon sa inyong stomach. So, yung GAVAGE naman po is yung purpose nung NGT ay mabigyan kayo ng proper nutrients kasi po hindi po kayo pwedeng kumain by mouth. So, magbibigay po ako sa inyo through the NGT na liquid form ng pagkain which is makakatulong po sa inyong pag-feed. So, after explaining the procedure to the client, I will now proceed to preparing the equipments. So, assuming that I have prepared the equipments, I will wash my hands and then perform hand hygiene and then wear gloves. So, assuming that I have washed my hand, I will proceed to wearing gloves. So, this procedure can be sterile and then it can be clean. It depends on the facility. So, I have worn my gloves. I'm performing this procedure in a clean technique. Okay, so after wearing my clean gloves, I will now position the patient to a high Fowler's or semi-Fowler's position. So, ma'am, kaya niyo po bang i-tolerate yung makaupo po kayo para po maging maayos yung ating insertion?
Yes po.
Sige po ma'am. Ipoposition ko po kayo ngayon ma'am. So it is important to position the patients this way para hindi makapasok yung tubing into the trachea which will cause suffocation to the patient. And it can also cause infection. So, pagka-position natin kay patient, i-identify ko na kung ano yung gagamitin kong tubing. So, ang gagamitin kong tubing is the size is F12 and then the color is white. So, assuming na ito yung NGT na gagamitin ko, pagkatapos kong i-identify kung ano yung size ng tubing, ang sunod ko namang gagawin is i-identify ko kung aling nostril ang i-insertan ko ng tubing. Using a pen light, ititilt ko yung head ni Ma'am Cassandra and then i-check ko yung nostrils niya, both nostrils. So, what I'm looking for is any obstruction or deformity in the nasal septum. So, pagkatapos kong i-check, i-ask ko yung patient kung pwede niyang takpan yung kung pwede niyang i-pinch yung kabilang nostril niya and then blow sa kabila. and then vice versa. So, ma'am, maaari niyo po bang i-pinch or diinan and then blow po? Okay, so other side po. Okay, thank you so much. So, ang pinili ko, since wala namang obstruction or deformities na na-observe, and parehas naman na maganda yung blow ng air sa both nostrils, ang pinili ko is yung pinakang convenient sa akin, which is the right nostril. Pagkatapos nun, ang sunod kong gagawin is i-measure ko na yung insertion length. Measuring the insertion length, I will start from the tip of the nose, and then towards the towards the earlobe, and then towards the xiphoid process. So, ayan, bago ako mag-i-insert, imamark ko muna. Pagkatapos kong i-measure, imamark ko na using a tape yung insertion length. And then, I almost forgot, I'm supposed to cover the chest of the patient using a absorbent pad or towel. So, ayan. So, I have covered it. And then, after ko na-identify ko na yung insertion length, i-cleanse ko na yung nose bridge ni Ma'am Cassandra. So, ayan. And then, after cleansing, I will apply skin protectant. So, pagkatapos nun, I'll get the tube. And then, I will also get the water-soluble lubricant. And put a little in my glove. So, assuming that I have already put water-soluble lubricant, I will lubricate the tip of the tube 4 to 8 inches, starting from the tip. Ayan. Making sure that everything is covered by the water-soluble lubricant. So now that I have lubricated it, I will now insert the tube on the right nostril of the patient. So first, I will tilt the head upwards and then insert it until it reaches the nasopharynx. So pagkatapos mag-reach na siya sa nasopharynx, ang sunod kong gagawin is get the tongue depressor and ask the patient to open their mouth. So, ma'am, please open your mouth. And then, what we are checking here is kung nag-coil ba yung tubing. So, ayan, hindi naman nag-coil yung tubing. And then, we will continue to insert the tubing. Bibigyan ko muna si ma'am ng water and straw. I-bend down ko yung kanyang head. And then, ma'am, please hold on to this po. And then, pag lunok nyo po, i-advance ko po ang tubing. So, ayan, sip, lunok, sip, lunok. Continue. Habang in-insert natin, mag-observe tayo kung may pagbabago ba sa appearance ni ma'am. Sa respiration, kung nagkakaroon ba siya ng cyanosis, or umuubo siya. So, ganun. So, since wala din ako na-feel na obstruction, isi-secure ko na yung, akin na po ma'am yung water. Isi-secure ko na yung tubing sa nose bridge ni ma'am. Aalisin ko muna yung ginamit kong mark. And then, lalagyan ko siya ng tape. So, ayan, nilagay ko muna sa nose bridge. And then, secure it with another tape. To make sure na hindi mag-withdraw yung tubing. So, ayan. Pagkatapos nating i-insert, Ang sunod naman natin gagawin is, i-verify na natin kung tama ba yung placement natin, kung pumunta ba yung tubing, yung tip ng tubing sa stomach. So, kukunin ko yung aking acetous syringe. And then, meron pa siyang valve. And then, kukunin ko din yung stethoscope. Tapos, susuotin ko siya. And then, bago ako mag-inject ng air, ipi-place ko muna yung diaphragm ng stethoscope sa may xiphoid process area ng patient as I inject air. So what I'm auscultating for is the whooshing sound, which is produced by the air that we are injecting to the stomach. So ayan, narinig ko na ang whooshing sound. The next thing that I'm gonna do after injecting and auscultating for the whooshing sound, I will aspirate for gastric content. So this is a second technique to verify the proper placement. So, ayan, nag-aspirate ako ng konti lang, hindi lalagpas sa 5 ml, and then kink the tubing, and then I have prepared here a kidney basin with pH 3. So I will place it here and then put some gastric content. And then kapag na-observe ko, mag-change yung color ng pH strip pag nag-change siya into red, and then ang ibig sabihin nun is yung pH level nung gastric content is within at range. So the appropriate range of the gastric content has to be less than or equals to 4. So after that, ang susunod kong gagawin is iti-tape ko na while kinking the tip of the tubing, i-secure ko na yung tubing sa gown ng patient. So, pagkatapos nating i-secure, ayusin ko lang yung towel ni ma'am. And then, magpo-proceed na ako agad sa GAVAGE. Since yun yung order ng doktor. So, ang una kong gagawin is, ika-clamp ko muna, assuming na naka-clamp na muna yung tubing. I-let go ko muna siya sa may likod ng pillow ng patient. And then, kukunin ko na yung formula na i-feed natin sa patient. I-check ko muna bago ko i-administer, i-check ko muna yung expiration date, and then I will be shaking it well para walang mga buo-buo yung feeding, and then which will cause blockage doon sa tubing. So ayan, pagkatapos nating ma-shake, yung assuming na yung order ng doctor is 250 ml, I will also get the sterile water, which is 25 ml. So, ayan, kukunin ko na yung clamp na tip na insertion point, na infusion port nung tubing. So, kukunin ko ulit yung acetous syringe, and then i-insert ko na siya dito. Alisin ko lang yung valve niya. And then, ang una kong gagawin is flush the tubing using sterile water. 25, it can be greater than 25 ml. So, ayan. I-let go ko na habang inubuhos ko. Assuming na inubos ko na siya. And then, habang hindi pa siya nade-drain, i-estimate na natin na i-clamp na natin siya agad. Para ma-prevent natin yung air na makapasok sa stomach ng patient. So, pagkatapos ma-flush ng tubing, i-administer na natin yung feeding. So, ayan, lagyan ko muna siya ng 60 cc. And then, unkink, let the feed flow. Make sure na hindi siya nadidrain para walang air. So, ayan, continue lang hanggang sa maubos yung 250 ml na order ng physician. So, I will be kinking it again kung assuming naubos na. And then, kung naubos na yung feed doon sa tubing, flush natin ulit using sterile water. Until malinis yung tubing, para ma-prevent natin yung bacterial build-up or parang yun. So, pagkatapos na, alisin na natin yung asepto syringe, making sure na nakakink siya ulit. And then, ang sunod naman natin gagawin is ika-clamp na natin siya. And then, pagka-clamp natin, ilagay na natin siya sa bedside or sa ilalim ng pillow ng patient. And then, pagkatapos nun, alisin na natin yung drape. Dispose the equipments used. And then, position the patient to a comfortable position. Ayan. So, pagkatapos nun, alisin na natin yung gloves. And then, perform hand hygiene, and then document. So, ngayon, assuming na after 3 days na siya, and then nag-order yung doctor na na kailangan ni patient ng cold lavage, na kailangan ni patient ng ice lavage. So, we will be providing her with an ice lavage, and then included din dun sa order na remove the NGT. So, we have already prepped the equipments. We have, I will now be introducing myself again to the patient, verifying the patient's identity, explaining the procedure, performing hand hygiene, wearing PPE. Yeah. So, hi ma'am. Nandito po ako ulit after 3 days. So, ako po ulit si Maricon Suñas, is ang inyong student nurse. Ako po yung nag-insert ng inyong NGT. So, maaari ko pang tanungin po ulit yung pangalan nyo?
Ako po si Colin De Vera po.
Kailan po kayo pinanganak?
August 14, 2002 po.
Okay, thank you po. So, ngayon ma'am, magpa-perform ako ng lavage. So, yung lavage po, lilinisan po natin yung inyong tiyan para po maiwasan natin yung infection or complication, assuming na meron kayong gastrointestinal bleeding. So, pagkatapos po natin mag-perform ng lavage, aalisin na po natin yung inyong NGT. So, ayan. After explaining, I will perform hand hygiene and then wear gloves again. Again, this procedure is not a sterile technique, but it can be sterile technique. So, ayan. So, ayan, as I've said kanina, I have prepared now the equipments for the lavage. Ibinabad natin or pinag-expose natin yung ating lavage solution sa cold water or ice. So, ang sunod natin gagawin is to get the tubing and then the asepto syringe. Ang sunod natin gagawin is to position the patient into a Fowler semi-sitting position or high high Fowler's position. So, ayan, naposisyon na natin si patient. And then, check natin ulit yung placement ng tubing. So, kukunin natin yung, mag-inject tayo ng air sa tubing niya and listen for the whooshing sound. Yun lang yung So, yun lang yung only way to verify the placement. Kasi, kung i-check natin yung pH level, it is normal na hindi maayos or normal yung pH level ng gastric content ng patient. So, mag-inject tayo ng air using the syringe and then place the diaphragm of the stethoscope near the xiphoid process where the stomach is located. Okay, I will listen for a whooshing sound while injecting air. So I have heard now the whooshing sound. Pagkatapos kong verify na tama naman yung placement, ang sunod kong gagawin is I will be inserting the septo syringe in the tubing, and then I will remove the valve of the septo syringe. So, ayan. Pagkatapos na nakakink yung ating tubing to make sure na walang air, kukunin ko na yung lavage solution. And then, I will be pouring the solution. Ayan. Until makareach siya doon sa tip. And kukunin ko yung basin where I'm going to be allowing the gastric contents to go out. So, ayan. I-unking ko na siya. Ayan. Assuming na nag-drain na siya, and then i-kink ko ulit siya. Tapos, pour ulit tayo ng solution. Uulitin natin yung step until maging clear yung gastric content na lumalabas from the tubing. So, ayan. Assuming na naging clear na yung gastric content, is set aside ko na muna itong mga gastric contents na nakuha ko from the lavage and remove this. I will now proceed to the order of the doctor to remove the NGT. So, ayan, aalisin ko muna yung pag-attachment niya doon sa damit ni patient. And then, remove the tape, micropore tape. And then, pagka-remove ng tape, ma'am, can you inhale po and then hold your breath for a few seconds po habang inaalis po natin yung tubing. So, 1, 2, 3, inhale. Okay, removing the tube until it gets out, and then you can exhale. Thank you so much. And then, we will dispose or discard this tubing. And then I will give the patient oral hygiene. I will give, and then you can gargle using this ma'am. And then this tissue po, you can blow through your mouth, your nose po. Thank you so much. And then after natin i-dispose yung mga equipments, I will position the patient to a proper position. So, are you feeling okay, ma'am? Do you feel any, okay. So, pagkatapos nun, I will get this, ayan, i-dispose na natin yung mga nagamit na natin. And then, I will be removing now the gloves and then performing hand hygiene. After performing hand hygiene, I will now finally document. So that concludes my return demonstration. Thank you.